All right, so today we're going to dive into a condition that affects millions of people, a lot of times pretty silently at first. It's called Chronic Obstructive Pulmonary Disease, or COPD for short. We're going to break down what it is, how you find out if you have it, and, the most important part, how you can manage it to live a really full life. We all get coughs, right? But what about that one? That one that just hangs on and won't quit? Or maybe you find yourself getting a little breathless after just a simple flight of stairs. It's so easy to just brush that stuff off, but sometimes they're the very first whispers of something bigger going on. Okay, so first things first, let's pull back the curtain on this mystery. What in the world is COPD anyway? Now, I know the name sounds super complicated, but it actually tells you everything you need to know. Chronic, that just means it's here for the long haul. Obstructive means something's blocking the way. And pulmonary, well, that's just a fancy word for your lungs. So put it all together, and you've got a long-term lung issue that makes breathing a lot harder than it should be. Okay, here's a really cool way to picture this. Think of the little air sacs in healthy lungs as brand new, springy balloons. When you breathe out, they snap right back and push all the air out. Easy. But with COPD, those same air sacs get damaged. They're more like an old party balloon that's been inflated one too many times, all stretched out. Air gets in just fine, but it can't all get out, and that stale, old air gets trapped inside. So you might be wondering, what's actually causing all this damage to the lungs in the first place? Let's move on and take a look at the main culprits behind COPD. Okay, there's no way around it. Long-term cigarette smoking is the #1 cause, hands down. But, and this is important, it's not the only thing. Years of being exposed to other irritants, like heavy air pollution or chemical fumes at work, can also do serious damage. And then, for a really small group of people, it actually comes down to genetics. They have a specific condition that means that their lungs just don't have the same natural protection. The really tricky thing about COPD is how it sneaks up on you over years and years. It might start out as something you barely notice, like getting a little winded on the stairs. Or maybe it's that smoker's cough that you've just accepted as your new normal. Because it's so gradual, a lot of people don't even think to get help until the disease has already made itself at home. Okay, so if any of that sounds a little too familiar, the next step is getting some real answers. And don't worry, the process isn't nearly as intimidating as you might think. Really, the whole path to getting a diagnosis is pretty straightforward. It all kicks off with just a chat with your doctor about what you've been experiencing. Then comes a physical exam, and after that, they'll move on to the key test that gives the final definitive answer. And this is the key test. It's called spirometry. It's super simple and not invasive at all. You just take a huge breath in and then blow out as hard and fast as you can into a little tube. That's it. The machine measures how much your airflow is limited, and that's what confirms COPD and even helps figure out how severe it is. So, getting a diagnosis, look, it's not the end of the road. Not at all. In fact, it's a starting line. It's the moment you get to open up this amazing toolkit and really start taking active control of your health. And this quote right here, it just sums up the whole modern approach to COPD perfectly. See, the goal isn't just about, fighting a disease. It's about managing the symptoms so you can improve your quality of life. It's about living better. So what's actually in this toolkit? Let's break it down. First up, you've got things called bronchodilators. Those are usually inhalers that help relax and open up your airways to make breathing easier. Then you have steroids to calm down any inflammation, especially when you have a flare-up. For some people, oxygen therapy gives that extra boost they need. But honestly, the real game changer for so many people is something called pulmonary rehab. It's this amazing program that mixes exercise, education, and support to give you everything you need to manage your health. All right, but beyond the doctor's office and the pharmacy, some of the most powerful tools, well, they're the things you can do every single day. Let's talk about some proactive lifestyle strategies. And what's so powerful about this list? Every single one of these things is something you can take control of. Quitting smoking? It is without a doubt the single biggest thing you can do to stop the disease from getting worse. Staying away from irritants, getting some gentle exercise, eating well, getting your vaccines, these are all ways you build up your body's defenses. And if you're looking for proof that this stuff works, look no further. Just think about this for a second. A program like pulmonary rehab can slash the number of times people end up on the hospital by more than half. That's a huge impact. And it's driven by you taking proactive control. So, when you boil it all down, understanding COPD is really about empowerment. Yes, it's a chronic condition, but it is absolutely a manageable one. It can be a part of your story, for sure, but it doesn't have to be the whole story. With the right tools, the right support, you have the power to take control. So the only real question left is, how will you take your next breath forward?